One of the world's largest drug companies has been fined $3 billion for promoting antidepressants to children and adolescents when they weren't approved for use. Australian public health advocates have welcomed American authorities' moves against Glaxo Smith Kline. The British drug maker has admitted it held back key data and made unsubstantiated safety claims about its high-selling diabetes drug, Avandia. As Bronwyn Herbert reports, the case is raising alarm bells here about Australia's self-regulated pharmaceutical industry.
Glaxo Smith Kline's $3 billion fine is a result of the biggest healthcare fraud charge in US history.
It's unprecedented in both scope and size. It underscores this administration's firm commitment to protecting the American people and holding accountable those who commit healthcare fraud.
This administration is committed to using every available tool to defeat healthcare fraud.
The global pharmaceutical giant pleaded guilty to the unlawful marketing of antidepressant drugs to teenagers, failing to report key safety data, and bribing doctors with gifts and inappropriate hospitality. Two of the drugs at the centre of the case, the antidepressant Paxil, sold in Australia as Arapax, as well as the diabetes drug Avandia, are widely prescribed here. And it was Australian researchers who played a key role in exposing some of these unlawful practices. Professor John Giardini is a child psychiatrist from the University of Adelaide. His team identified major flaws in a prestigious medical article that stated Paxil was effective in treating depression in adolescents.
As a result of that, I was contacted by an American law firm and given access to a range of internal documents from what was then Smith Kline Beecham, is now Glaxo, the company that's just recently been fined. And when we went into those documents that had been provided, it was quite clear that this article that had been published was false and misleading.
Public health advocates say the same unethical practices highlighted in the US do happen here. But in Australia, the same level of prosecution can't take place because the industry is self-regulated.
The problem with self-regulation and the numerous codes is, firstly, they're self-serving. The average fine is $50,000, for example, for Medicines Australia, which is an interesting comparison with the $3 million in the US.
On the Gold Coast, Dr. Philip Morris has been working as a psychiatrist for more than 20 years. He says financial inducements from industry are widespread and he's had plenty of offers.
It involves usually a business class airfare, accommodation at the conference hotels, which are often very upmarket hotels, payment of the registration fee for the meeting.
Dr. Morris says what's critical now is that pharmaceutical and medical companies fully disclose who they're paying.
They don't give this to all doctors. They only target the ones that they call opinion leaders, and they're people that have the most clout or influence in the profession, particularly perhaps over prescribing habits.
Even with generic pharmaceutical companies, it's not mandatory to be a member of an industry group. Last year, an Indian drug company producing generic cholesterol-lowering drugs showed how it's possible to flout industry self-regulation.
Ranbaxy gave an offer to pharmacists of $15,000 of free stock if they would preferentially dispense Ranbaxy's product. Now, that offer to a health practitioner to preferentially use a particular product is against certainly Medicines Australia Code of Conduct and certainly against the generic medicines industry Code of Conduct. But Ranbaxy, not being a member of any of those associations, was not obliged to follow their code.
Still, no penalty has been applied. The organisation representing big pharma companies defends the status quo.
No, on the contrary, self-regulation works, and I actually think that the way the medicines industry in Australia has approached this is actually a model for how self-regulation works.
Medicines Australia was out on the front foot today. It's just submitted its revised Code of Conduct to the ACCC for authorisation and says for the first time this means its member drug companies will be required to disclose all aggregate payments made to doctors and consumer groups.
The changes we're making are quite substantial. The new Medicines Australia Code of Conduct, which we're submitting for authorisation, which will take effect in January next year, will have a whole range of new reporting requirements for companies to report the interactions they have with doctors and the payments they make.
But it's not enough to silence the critics. Even under the new code, doctors here are not required to be individually identified, while in the United States, the new so-called Sunshine Act requires far more disclosure.
In the United States, they now have a law that says that doctors who get more than, say, $100 from an individual drug company go on a public register so that that can be accessed by those who are interested. I think we should have something similar to that in Australia.
That extra regulation is something Medicines Australia says is too costly.
But rather than just jumping on the bandwagon straight away and saying we'll be totally transparent tomorrow, there are a lot of issues to sort through about accuracy of reporting, the cost of reporting.
Glaxo Smith Kline Australia said there were no implications from the US case on its medicines sold in Australia, and the Australian public should not be concerned that fraudulent practices have occurred.
Bronwyn Herbert reporting.